The first test that I would like to talk about is the antral follicle count. So follicles are fluid pockets that contain eggs. And even though a woman has thousands of eggs in the ovaries and she's born with all her eggs, every month when a woman gets a period, there are a certain number of eggs available in follicles. And the more follicles a woman has, the more fertile she is. Day 3 of her cycle, estradiol and FSH hormone. Estradiol is a woman's main female estrogen, and typically on cycle day 3 that level should be less than 60. The other hormone I mentioned, FSH, stands for follicle stimulating hormone. So that's the hormone that is used to get a follicle to grow every month. And a fertile range for that is 10 or less, the lower the better. There's a little bit of a twist on the day 3 estradiol and FSH level. A little fancier test is to do a test called a Clomid challenge test. Now, a Clomid challenge test, the way that works is a woman takes Clomid, which is a fertility pill, 100 milligrams, which is 2 pills on cycle days 5 through 9. We do an estradiol and FSH on day 3 and day 10. So a normal result is the FSH level being 10 or less on day 3 and day 10. Now, if the FSH level is greater than 10 on either one of those days, a woman now can be diagnosed with what's called diminished ovarian reserve, DOR. That's the first stage of abnormal reproductive life in women. So it's the stage between normal reproductive life and perimenopause. And the thing that's kind of unusual about DOR is that women have periods, they don't have hot flashes, there's no symptoms, there's no clue there's a problem, but we can pick up women that are in diminished ovarian reserve with the tests that I've mentioned so far. Antral follicle count, day 3, estradiol and FSH, or Clomid challenge test. Now there's a newer test called anti-Müllerian hormone, or AMH. Now this test is also helpful. If the AMH level, you want it to be greater than 1, the higher the better. So it's kind of the opposite of the FSH. So FSH you want to be low, AMH you want it to be greater than 1, the higher the better. So if we look at the woman's age, the day 3 estradiol and FSH, the Clomid challenge test result, and the AMH level, I am able to assess a woman's fertility potential.